Sorry, didn't have a mic on. Good afternoon, everyone. Welcome to Health and Human Service. Call the roll.
Commissioner Baker McCormick. Commissioner Marecki, excuse me, Commissioner Marecki has requested an excuse. Commissioner Anderson. Commissioner Colleen.
Here.
Chair Scott,
Present.
you have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
Well, I would like to make a remark today about one of our commissioners, congratulating her on Women's Month, Commissioner Monique Baker McCormick from the clerk's office. You're
appreciated it. I really needed it that day too. And I told her, I said, thank you. You're right on time.
And when I
So-
saw it, I said, she needs this.
Thank you.
So
Thank you
that's
so
why
much.
I'm reiterating it. Yeah. Because I thought it was so nice. Okay, next item, please.
C, approval of the February 25th, 2025 meeting minutes.
Moved by Commissioner,
Anderson. Fine.
Anderson. Okay, forgot we're on the tablet.
Second it.
I'll be second.
There you go.
Okay, Commissioner Tim Colleen. Well, who was
No,
it?
no.
It was me then. Oh, what? Oh, okay.
Tell him in a second.
Oh, okay. All right. Okay. I thought your picture was up there just because you were talking. Okay. Well, thank you so much. All in favor? Okay, thank you. Okay. Mission, approved. Next item, please.
D, unfinished business. There is none listed.
Next item.
Moving to item 1 under new business. Requesting commission approval of Amendment 1 to a 1-year grant agreement with the Michigan Department of Health and Human Services to accept additional funding through the fiscal year 2025 Local Health Department Comprehensive Grant to carry out program activities for numerous local health department program services.
Thank you. And she is here.
Good afternoon, Commission.
Good
Dr. Brianna Osorio, Director of Public Health Division. And this is our annual CPBC agreement that we get from MDHHS to support several of our programs across public health. And this was just an amendment that we knew that was going to be coming to support some of our programs like Hearing and Vision. They just reanalyzed and did a new algorithm for us. So our base pay will actually increase. So that was really helpful. So that will really support our efforts there, as well as our Healthy Families America, our home visiting program, and just to right size the salary for a lot of our staff that work under that program. And then we got also an increase for our social determinants of health hub pilot that we're piloting as well. So so this is what a lot of those efforts are going to be
Okay,
for.
how is the program going?
A lot of them are for which one specifically? There's a couple of them that are being supported by this amendment.
Okay.
So Hearing and Vision is going really well. We're able to actually update a lot of our equipment for this program. And since we have some of the new initiatives of partnering with some of the local one of the local programs to help us improve access to care. We're doing really well with our follow-up rates. And we're even hosting a lot of our training for the state is being hosted actually at the at our building as well. So
Wonderful.
that's been awesome.
Thank you. Any questions? Commissioner McCormick and Commissioner Anderson.
Thank you, Madam Chair. For your vision programming, does this include the mobile unit or?
No, that's
separate.
separate. Yep. This is just for the actual base program, and they have not looked at the algorithm, they said, in over like 15 years. So it's just one that they have done to right size the funding for those programs. And so we were able to get our increase. So this will also help us to add a more hearing and vision techs, just to make sure that we're reaching all of our school districts.
And the vision program, the mobile unit,
Mhm.
how is that going? Is it
It's going really well. We just finished out a few of our first districts. And so our follow-up rate is now at 100% and used to be at 3%. So that's been really awesome.
Okay, so if we wanted to get the mobile unit in for one of our communities,
Mhm.
would we just
You can reach out. Yeah, reach out to us. We have a few that we have over for the next 3 years that we're scheduled with. And our chief program officer and the special teams there helping us kind of implement this, as well as our hearing and vision coordinator. So they're just working with the school districts, making sure that we have a champion basically in every school to be able to set this up to make sure that we get those services provided.
Great, thank you.
No problem.
Thank you. I attended the one in Highland Park. It was
Yes.
really wonderful.
It was.
Yes. Thanks again for that.
No problem.
Commissioner Anderson?
Thank you, Madam Chair. And thank you for a great report. I always love your enthusiasm and for what you're
Yes.
doing. And I think it means that your facts and figures that you're telling us about, I think indicates that you're doing a great job.
Thank you.
But I did want to ask about a flyer for the services that are provided through, and I would assume that the location that you're talking about is the one in Wayne, is it? Is it on
Yes.
Van Born Road?
Yes. So we're just providing our state training. So the state has actually asked us to just host the training there at the at our health administration building in Van Born. So that's where we're going to be having like all of our hearing and vision, all the hearing and vision techs that are new that need to do all of their state accredited training. They'll be coming, and our state DHHS, they will be coming to actually to do that training.
Oh,
So, yeah.
Good. So I'm wondering, when would it be something that we could advertise on our newsletters to let people know? That
Oh,
we could
and
get-
that's okay. So that's for the vision program that we're that initiative. So that's something that we are working with with Vision to Learn, our partners. And so I will say, I mean, you can. I don't know if we have flyers that have gone out yet. I know we have started marketing out to all the school districts that we are specifically focusing on, of those that have higher free lunch rates too for the students. So we're really prioritizing those right now, and then we'll continue to expand. So we're just starting kind of like that planning and implementing phase, but we definitely, as we get more information, we can definitely send that out to you
Yeah,
all.
if you could, that'd be
Yeah.
great. I mean, I think most of us have Facebook pages that we
Yeah.
disseminate information to the public, and
Yeah.
we can also provide it to our local communities too, to put it in their newsletter, and but it would be great to, once you're ready to provide that, would be appreciative. And I guess so you're saying that the vision or the hearing,
Mhm.
neither are ready at this point. The training and that is not there yet.
Well, we have the training already done. Like all of our techs are trained, but it's just Vision to Learn that is the partners that we work with that do the follow-up service. And so that's really important for the state, because before we were kind of in a deficit there where we did not see a lot of follow-up after we had let the parents and the guardians know that their kid had failed their vision screening or hearing screening. A lot of the times that would just let them know, hey, your child needs some follow-up care. And so we had not been hearing back from parents a lot of the times. And so we really see that access to care is like a huge part. So this has just been a way that we've done that. And so we're just making sure that we're reporting on who's been getting that follow-up care and the type of services they've needed. So that has been really helpful for the state to see those numbers as well, because that shows that we're kind of closing that loop and really bridging that gap.
Are there resources for those that in the schools that you find the children that need vision, need glasses, need, I would assume you don't have too many children that need hearing aids, but anyone that, do you have access to provide those for
Yeah, so we do have some of those numbers of what we're getting, you know, and percentage wise of each of the schools that we're going to, and that Vision to Learn is coming after us. That will basically pass off, the schools are basically passing off that list to make sure those kids get the follow-up care. So I think we're about 80% of those kids have also received, like 1/3 of them have failed their screenings, but about 80% of them are actually getting the follow-up care, that have needed the follow-up care and actually get glasses. So some of them, you may just fail because you already have glasses. So that's just normal, but we're still providing all of that as well. So
The glasses are provided at
yeah, the
center
glasses are
also?
provided as well. We send them out after they go through all of that.
Something just to keep in the back of your mind, and you may have already thought of this because you seem to be on top of everything, is the Lions clubs, the local Lions clubs. You know, that one of their missions is to provide glasses to children that need glasses.
Awesome.
And they basically pick up the tab. They will provide contact with optometrists. But anyway, it might be something down the road that you could figure out a way to include them too, because
Yeah.
that's one of their missions, and they collect used glasses.
Okay.
Probably everybody's heard of that. And one thing you may not have heard me admit that I had my first pair of glasses through my school.
Wow.
They sent me, the Lions Club bought my glasses. And so I'll never fail to drop a buck or so in when they're collecting money for the Lions Club. But they noticed, my teacher noticed that I needed glasses and set me at the front of the class, which was sort of embarrassing as for a ninth grader.
Yeah.
But it was something that really helped because she had the contact, and through the Lions Club, they paid for my first pair of glasses. So,
That's amazing.
but anyway, there is a need out there. Thank you.
Yes.
Thanks.
That's great. And there was a nice selection of glasses too that they have to choose from.
Mm-hmm.
Yeah, it's very nice. Now, do you send these letters out to all the schools countywide?
We send, we have a couple of school districts that we've already worked with or beginning to work with already. So, our coordinator as well as Vision to Learn's coordinator are just going to those schools, getting our MOUs, kind of setting up the foundation of what this program is going to look like as we continue to expand. And we're just thinking about long-term how we want to continue to add in more schools. But we're already getting calls of more school districts that want to be able to tap into this. So it's more of we're trying to make sure we build up our capacity, and this additional funding is also very helpful. So that way we have enough hearing and vision coordinators, hearing and vision techs to be able to go out there and do that work. So
And I'm sure that word of mouth gets out there too.
Oh, yes, it
Yes,
does.
Right, great.
Yes, it is.
Wonderful. Thank you.
No problem.
Tim?
Thank you, Madam Chair. Just to finish on that, we only work in public schools, right?
We work in public schools and, yes, pretty much all public schools and all out Wayne County school
I was
districts.
going to say, can we work Detroit Public Schools?
No.
Okay.
No.
About how many, just round numbers?
Yeah.
About how many kids a year are successfully served with hearing and vision issues?
So this past year, we did probably over 100,000 kids that we screened for. So we start with Head Starts. And we've increased after COVID too, because a lot of schools were not comfortable with having us come in as well. So we've made some leaps and bounds since then.
So how many kids show up having issues in the screening and then actually get what they need?
Probably
More or less.
probably a third of them actually have overall, what we see in statistically is
You
about a
said
third
that.
of them that actually need those services.
Right.
But right now we are about 80% of them are actually getting that follow-up care.
80% of the
Yeah.
1/3.
Yep.
Beautiful.
Yep.
I don't know, this 2.4 million, that looks like a little bit more than we usually get in one of these amendments to me. I'm not going to ask you to comment on it. Where does the money, which category is the money for your social determinant effort? Which category?
So
is
we
that?
we got the additional 1.6 for the SDOH. So I know it says here
I-
special health
Don't
care, but
acronym me, what is
Yeah.
it?
I don't know why it says Children's Special Healthcare, but it's for SDOH hub as well. And so we've gotten that increase. So that's majority of what the amendment was for
So that's
this
social
time.
determinants.
Yeah, just social determinants of health.
Is the
Yes.
vaccine initiative still attached to that?
No, the vaccine initiative is not still attached to
Okay.
this. Yes.
So what are we going to be able to do with 1.6 around social determinants?
I will let our Deputy Director, Harlan, she is leading a lot of our efforts in Social Determinants of Health Hub here. So she'll be able to share with you a little bit more what we plan to
Delighted
do.
that the county has a social determinants program.
You and good morning.
Your mic.
Oh, thank you. I always do that.
There we go.
Committee Chair Scott and committee members, thanks for having me. I'm Harlan Nemo. I am Deputy Director and Chief Health Equity Officer for our Department of Health, Human and Veteran Services. So the Social Determinants of Health Hub is actually a framework established by the Michigan Department of Health and Human Services about 4 years ago. And they were disseminating funding to Detroit, Kent County, Wayne County, and to several nonprofits to establish infrastructure around social determinants. And so under Dr. El Sayed leadership, that was about a year ago. We told them that we were ready to move with this. And so they began with the SDOH hub planning. And basically, we proposed to them that we wanted to increase our outreach to our communities. And so with that funding, we've brought on 2 community health workers that would help with our outreach activities. To date, we've had 2 outreach activities led and put on by our health department, by HHVS. Even though in the past we participated in other outreach activities, this one we're leading it and we're being really strategic about it. We're planning a housing outreach activity event for March, April as well, and just thinking through some of the needs of our community. We are also funded to increase training and education around health equity. So basically working with the Michigan Public Health Institute to lay out training for our team members so that we have a standard knowledge about how to deliver the work that we do in an equitable way. Another is that we are with this, the community health worker, they are establishing an assessment so that when we go out into the community, we're also asking our community members that whether they need help with food, whether they need help with housing, healthcare, and then we actually help navigate them through the system. So that's one of our key projects. Looking across our departments, we have a lot of resources that we can offer across veteran service, across public health, clinical care services. However, the capacity to be able to serve the community in a coordinated way, this is what we're building. So our assessment will be able to, from every division, refer to our community health workers. So that's one. From the community, refer to our community health worker. And we serve as that coordinating body to connect them to social services. And that way we really are able to assess the need, have data to track what the needs are so that we can close the gap, capacity gap, and be able to have a warm handoff. Because oftentimes we'll refer people to services and not follow up on it. So the community health workers are really kind of keeping this, the glue, keeping the pieces together. I want to talk about the increase too. So about 2 years ago, there was legislation from the state that released some funding for food service delivery program. So this is the state being really intentional about our food service delivery through our retailers, our food retailers. And they identified that there's gaps in food delivery for those who are on SNAP. So they're able to order food, but there's transportation challenges sometimes in picking up the food. So they decided to allocate some funding that will supplement food delivery services. So local health departments will be able to, or community-based organizations will have part of funding to be able to supplement with a Kroger or a Meijer or whatnot. We were really in the place where we are building out our Fresh Truck program. And so we're working on outfitting 2 food delivery trucks that will have fresh fruits and vegetables. So the state allowed us to be able to fund our own food delivery service program. So that's where the 750,000 increase came in, because now they're saying this is a food delivery service. We can increase the number of produce, and then we're also building a data system that would track the utilization of our services, track the number of SNAP recipients that are receiving our services. And then we put a small pot of funding aside to be able to support local retailers with food delivery as well. So
So about 700,000 of that 1.6 is going to go to the fresh food.
1.2 of the 1.6, and then 300,000 is for the community health worker, the outreach, social determinants of health outreach. We're also looking into a community information exchange to support the connection to community-based organizations.
Over at Authority Health, we have a fresh food project that we're doing also in certain zip codes. I don't know if you talked to them,
Yeah,
but placing
the vending machines.
a little refrigerated unit in stores or gas stations that have, okay. So you
We've
know,
connected with Authority Health, and our last outreach at Wayne County Community College in Taylor, they were there doing Medicaid enrollment as well as talking about the vending machines.
you mentioned needs assessment. Are we doing a countywide needs assessment?
Yes, we are.
Because the way it was presented here sounded like you were going into individual communities with your community health workers and maybe developing for that community assessment. But we're working on an overall needs assessment for the county.
So I'm sorry, just to clarify, the social determinants of health assessment is just a form. It's a form.
Oh, I
So-
see.
Yeah, so
Okay.
when we go out to communities and they come to the health fair, they can also complete this form, and then we can follow up with them. So that's that individual. But we are doing a population-based community health needs assessment that covers all of Wayne County.
And when do you think we're going to see that?
Very soon. We're working with our community-based partners on our steering committee, and they're providing very good feedback. We want to make sure that we're getting the solutions from all over Wayne County. And yeah, so
Because we,
I don't want to give a date, but very,
No, I
very
got you.
soon.
well, I've been looking at these Robert Wood Johnson Foundation county, Michigan County
Mhm.
Health,
The rankings.
the rankings, yeah,
Mhm.
and we're always at the bottom. So this needs assessment that we will complete for the county, that will be our action plan
Yes.
to get, okay, very excited to see that. So
Yep.
thank you guys very much for what you do, and thank you, Madam Chair.
Thank you. Yes, thank you so much. Both of you. Okay, we'll just move on to the next item, put them all together. Okay. Madam Clerk.
Item 2, requesting commission approval of a cooperative purchase agreement with the Berger Chevrolet to purchase 5 vehicles for the Department of Juvenile and Youth Services Warrant Enforcement Bureau.
Good morning, Madam Chair. Melissa
morning.
Fernandez, Director of Juvenile and Youth Services. This is a request for approval for a co-op ideal agreement to purchase 5 vehicles for our Warrant Enforcement Bureau that sits under Juvenile and Youth Services. They are responsible for Youth on Tether, 2 years ago, we had 40 young people on tether and 2 officers. Recently, we have had up to 120. Today, we have 97 young people on tether. And so we've increased our warrant enforcement team now to 7. And so we need additional vehicles so that they can continue to conduct spot checks and intervene with young people on tether.
All right, thank you. Commissioner Khalil.
Well, I just want to comment really quick. 5 vehicles for 30,000 each. You can't buy used cars for 30,000 these days. That's just my comment.
Oh, okay,
That jumped out at me when I saw it. Really? Okay, that's it.
all right, Commissioner McCormick.
And that was kind of what I was gonna say that, and I assume that's why we went with a Grand Rapids
That's correct.
business, because they made it real affordable.
That's correct.
All right, thank you.
Commissioner Anderson.
Thank you. I just, one of the things along the same line that Commissioner McCormick, Beck McCormick brought up is, do we have any ability that if we get I know we can take advantage of this purchase plan, the My Deal. Do we have any flexibility that we could then say to a local dealership, match this or beat this, and we'll take your bid?
I'm not sure. I believe so, but I think then we'd have to go through a separate procurement process for that vehicle where the My Deal Co-op allows us to move a little quicker because it's already been vetted through the state system.
Okay. Yeah, because I'd like to explore that,
Sure.
Steve, because we certainly would like to help the dealers that support our local communities whenever possible.
Absolutely.
And I think there might be some flexibility there, but if it's, I'd just like to find out if it is. Number 2 is, one of those vehicles was a lot different than the other vehicles in cost. It was same, I think some of the other ones they were in the $25,000-$30,000 range, and another one that was over $40,000. So what's the difference between those two, or those of the 5?
I believe the Traverse might be a bigger vehicle.
Mhm. And was there some necessity to have a bigger vehicle?
The warrant enforcement, the Wayne County Sheriff's requested these vehicles, so I'm sure they have an assessment, but we certainly can get back to you on that.
If you would. Thank you.
Commissioner Khalil.
Yeah, I'm sorry, Madam Chair. I forgot when I had. You had a command performance on TV last night on the Moving Forward program. Could you
Yes.
share the URL with everybody?
I sure will.
Because you sent out an email on us saying, watch it.
I know.
And I'm like, okay, thanks for the hour notice.
Well, we
but,
were,
But if you could just send that out to everybody so everybody can see.
Sure.
what
Fox 2 notified us 10 minutes before and said it's hitting the air at 5:15.
Oh,
So
okay.
we will definitely share that with you. We're very proud of that segment.
Thank you.
Yes.
Thank you, Madam Chair.
You're just gonna send it out to all
I
of
sure
us.
will.
Okay. Thank you
You're
so
welcome.
much. Yeah. Any more questions? Hearing none. Thanks again.
Thank you.
All right, need a motion for 1 and 2. Oh, I forgot about the addenda. Thank you. Next item, please.
Moving to the addenda, item 3, requesting commission approval of the reappointment of Kenya Ruth to the Detroit Wayne Integrated Health Network Board.
Is Miss Kenya Ruth here? Okay, well, this is a reappointment, so. And then the next one will go on to,
I served a fair number of years with her on that board over there.
mhm.
And she is an East Sider but I just know she's also a past chair of the board. She's done a very good job as a board member over there. I just want to say that.
Well, she
And
comes
the
with
same for. Ms.
great
Brown.
recommendations.
And the same for Ms. Brown on the next one.
Okay,
Cause she does, she's chaired our finance committee over there for quite some time.
okay.
She's like the finance person for Triumph Church.
Oh.
And she brought a lot of expertise to the board when she brought her financial background with her.
Okay.
So I will speak good things for Ms. Brown as well. Thank you,
All
Madam Chair.
right, thank you. Anyone else? No, okay.
I will say that I know Ms. Brown personally, and I think she would be a great appointment or reappointment to the board, so.
All right. Thank you. All right, next item.
Item 4, requesting commission approval of the reappointment of Dora Brown to the Detroit Wayne Integrated Health Network Board.
Okay, I guess we've taken them both together already. Okay, now I need a motion. Okay, this is a motion for 1 through,
McCormick and a support by Commissioner Anderson
oh.
for items 1 through 4.
All right. Thank you. All in favor?
Please vote using your tablets.
Any opposed? Hearing none. All right, thank you. They're all on the tablet, all right.
Motion carried.
Okay, thank you. All right. Next item.
F, such other matters as may be properly submitted before the committee.
I don't know of any. Next item.
G, public comments.
Anyone online or see anybody?
No one on Zoom indicating that they would like to speak.
Okay. Go ahead. Oh, you said no one.
No one.
All right, thank
And no
you.
emails received
Okay,
either.
thank you so much. Next item. Oh, anyone in the audience would like to have anything to say? Anyone in the audience? No one? All right, thank you. Next item.
Adjournment.
Move to adjourn.